Question 1. Which of the following is the most accurate definition of parasiticide, and how does its classification affect its use in veterinary medicine? A parasiticide is a drug that kills only external parasites and is administered orally to pets. B. A parasiticide is a drug used to kill any type of parasite, including both internal and external parasites, and can be administered in various forms: oral, topical, injectable. C. A parasiticide is a drug used exclusively to kill internal parasites and is administered topically to pets. D. A parasiticide is a drug used only internal parasites and can only be administered through injections. Answer: B. A parasiticide is a drug used to kill any type of parasite, including both internal and external parasites, and can be administered in various forms: oral, topical, injectable. Explanation: a parasiticide is any drug used to kill or control parasites, including both internal parasites, e.g. worms, and external parasites, e.g. fleas, ticks. These drugs can be administered in various forms depending on the type of parasite being targeted and the form of treatment. It is important for veterinary technicians to understand the correct classifications of parasiticides, as misuse can lead to ineffectiveness or toxicity. The selection of the appropriate parasiticide depends on the species being treated, the type of parasite, and the method of administration, which should always be done under veterinary guidance. Misadministration, such as applying an oral drug topically, result in ineffective treatment or adverse effects. Question 2. Mr. Harris brings his dog, Max, to your clinic after noticing that Max has been vomiting and experiencing lethargy. The veterinarian orders a blood test and a fecal examination. Upon the examination of Max's fecal sample, you identify roundworms Toxocara canis under the microscope. Based on this finding, what is the most appropriate course of action for treatment, and what considerations should you take into account? Administering the medication. A. Administer an antibiotic to Max, as roundworms are bacterial parasites, and monitor for adverse effects. B. Administer an anthelmintic drug to eliminate the roundworms and ensure that the dog is not pregnant or debilitated, as this could complicate treatment. C. No treatment is required, as roundworms will resolve on their own within few weeks. D. Administer topical insecticide for external parasite control and follow-up in weeks. Answer: B. Administer an anthelmintic drug to eliminate the roundworms and ensure that the dog is not pregnant or debilitated, as this could complicate treatment. Explanation: Toxocara canis is an intestinal roundworm commonly found in dogs, especially puppies. The treatment for roundworm infections typically involves the use of an anthelmintic anti-worm drug. These drugs are specifically designed to target and eliminate the roundworms. However, a veterinary technician must consider certain patient conditions before administering the medication. Pregnant dogs, for instance, should not receive certain anthelmintics due to potential toxicity to the developing puppies. Additionally, debilitated or very young animals may require adjusted dosages to avoid adverse effects. Antibiotics would not be effective in this case, since roundworms are not bacterial in nature, and topical insecticides are used for external parasites like fleas or ticks, not internal parasites like roundworms. Question 3. Which of the following methods is the most effective for ensuring safe and accurate drug administration when preparing a medication for a veterinary patient? A. Calculate the dose of medication based on the patient's weight and ensure that you administer the drug as per the veterinarian's verbal order without checking the label. B. Always double check the drug label. Confirm the correct dosage and recheck the patient's weight to ensure proper administration of the drug before proceeding. C. Administer the medication immediately without verifying the drug's expiration date, as long as it was prescribed by the veterinarian. D. Use the drug administration equipment provided by the clinic without considering the medication's indications or contraindications. Answer: B. Always double-check the drug label, confirm the correct dosage, and recheck the patient's weight to ensure proper administration of the drug before proceeding. Explanation: the safe administration of veterinary medications is crucial for both the effectiveness of the treatment and the safety of the animal. This includes verifying the correct drug and dosage, ensuring that the drug is appropriate for the species being treated, and adjusting the dose according to the weight of the animal. Incorrect drug administration can lead to serious side effects, including toxicity or ineffectiveness. Veterinary technicians are responsible for double-checking the drug label for accurate medication name, dosage, and expiration date. Rechecking the weight is important, as the correct dosage is often calculated based on the animal's body weight. Relying solely on verbal order or not considering the contraindications of medication lead to errors, potentially compromising the animal's health. Therefore, a meticulous approach is necessary to avoid dangerous mistakes. Question 4. Which of the following best describes the process of drug compounding in veterinary practice? A. It involves the combination of two or more commercially available medications to create a new dosage form based on the veterinarian's specific prescription. B. It involves the use of over-the-counter medications to create customized therapeutic plans for pets without prescription. C. It refers to the process of selecting only generic medications for all treatments in veterinary practices. D. It involves purchasing medications, licensed wholesalers, and distributing them without alteration to clients. Answer A. Explanation. Drug compounding is a process wherein a veterinarian combines two or more commercially available medications to create a new dosage form tailored to a specific patient's needs. This practice is critical when an animal requires dosage form, strength, or combination that isn't commercially available. Compounding should be done by licensed pharmacists who adhere to strict safety and quality protocols. It is important veterinary technicians to understand compounding procedures to ensure accurate preparations and safe administration. The other options do not accurately represent the practice of drug compounding and fail to meet the appropriate safety or legal standards. Question 5. When assessing an animal's pain, which of the following is the most reliable indicator of pain in an animal? They physical signs such as increased heart rate, vocalization, and limping. B. The animal's increased appetite and willingness to play. C. Changes in the animal's sleeping patterns, such as excessive sleep. D. The animal's ability to maintain its usual posture and demeanor. Answer A. Explanation. When assessing pain in animals, reliable indicators include physical signs like an increased heart rate, vocalization, and limping. These signs are often associated with distress or discomfort. Animals cannot verbally express pain, so veterinary technicians must rely on behavioral and physiological cues to assess their condition. Pain can manifest differently depending on the species, and it is critical to observe subtle behavioral changes, such as restlessness or reluctance to move, in addition to physical signs. Changes in appetite and posture, as seen in options B and D, may indicate distress, but they are not as specific as the sign. Option A. Question 6. Mr. Smith brings in his dog Max, who has recently ingested a potentially toxic substance. He is concerned about Max's symptoms, which include drooling, vomiting, and lethargy. What should the veterinary technician do first? A. Administer activated charcoal to absorb the toxin and monitor Max's vital signs. B. Immediately prepare Max for an X-ray to determine the location of the toxin. C. Stabilize Max by providing oxygen and intravenous fluids before any procedures. D. Call the poison control hotline and wait for their instructions before proceeding. Answer C. Explanation. In emergency situations where an animal has ingested a toxic substance, stabilizing the patient is the first and most critical step. The veterinary technician should administer oxygen if the animal is in respiratory distress and provide intravenous fluids to support circulation and kidney function. This helps stabilize the animal before any specific treatment is initiated. After stabilization, further diagnostic steps such as administering activated charcoal, option A, or taking radiographs, option B, can be performed to confirm the toxin's presence or the extent of injury. While the poison control hotline can provide useful information, it should not delay immediate stabilization, option D. Question 7. Which of the following is an essential aspect of infection control in a veterinary hospital setting? A. Using the same gloves and personal protective equipment for all patients throughout the day. B. Regularly sterilizing the surgical instruments and disinfecting surfaces according to the infection control protocol. C. Keeping pets in the same area to avoid cross-contamination between animals with different infections. D. Minimizing hand washing between tasks as long as gloves are worn. Answer B. Explanation. Infection control is crucial in veterinary practices to prevent the spread of diseases, especially zoonotic infections. Regular sterilization of surgical instruments and disinfecting surfaces is essential to maintaining a clean and safe environment. Proper handling and sterilization procedures minimize the risk of cross-contamination and transmission of infections between patients and staff. Option is incorrect because reusing gloves without proper cleaning increases the risk of contamination. Option C is also incorrect as animals with different infections should be isolated, not kept together to prevent cross-contamination. Option D is wrong because hand washing is essential even when gloves are worn to reduce the risk of infection. Question 8. What is the primary purpose of pre-anesthetic assessment in veterinary practice? A. To determine the correct type of anesthesia to use based on the patient's health status. B. To ensure the patient is not allergic to anesthetic agents. C. To prepare the surgical area for the procedure. D. To guarantee the anesthesia protocol is suitable for all species. Answer A. Explanation. The pre-anesthetic assessment is crucial to determine the correct anesthesia protocol based on the patient's health status. The assessment typically includes evaluating the animal's medical history, physical examination, and laboratory results to assess the risks and select the most appropriate anesthetic agents and dosage. This helps ensure safer anesthetic experience for the animal. While identifying allergies, option B, is important, it's just one part of the assessment process. Proper preparation of the surgical area, option C, and species-specific protocols, option D, are also important but are secondary to ensuring the patient is medically prepared for anesthesia. Question 9. Which of the following is true about the role of a veterinary technician during a surgical procedure? A. The veterinary technician is responsible for making the final decision on the surgical approach based on the patient's condition. B. The veterinary technician assists the veterinarian by preparing the patient, ensuring sterile techniques, and monitoring the patient during surgery. C. The veterinary technician performs the surgical procedure independently when the veterinarian is unavailable. D. The veterinary technician monitors the patient's anesthesia after surgery but not during the procedure. Correct answer. B. Explanation. Veterinary technicians play a vital role in supporting veterinarians during surgeries. They are responsible for preparing the patient, e.g., shaving and disinfecting the surgical site, ensuring sterile techniques are maintained, and monitoring the patient's vital signs, including anesthesia levels, throughout the procedure. Veterinary technicians do not make final decisions on the surgical approach, option A, or perform surgery independently, option C. Monitoring after surgery, option D, is important, but the technician is also responsible for monitoring anesthesia during the procedure to ensure the animal's safety throughout the surgery. Question 10. When dealing with zoonotic diseases, which of the following should be considered as a primary precautionary measure to protect both the animal and the staff? A. Wearing gloves and face masks is optional as long as the animal is not symptomatic. B. Animals should be isolated if they are suspected of having a contagious zoonotic disease. C. Only veterinary staff handling the animal should be informed about zoonotic disease precautions. D. Disinfecting the clinic after each animal visit is more important than taking personal protective measures. Answer. B. Explanation. Isolation is the most critical precaution when dealing with suspected zoonotic diseases. Isolating the animal prevents the spread of the disease to other animals and staff, reducing the risk of contamination. Proper personal protective measures, such as gloves and face masks, should always be worn, even if the animal is asymptomatic, as some zoonotic diseases can be transmitted without obvious symptoms. It is essential that all staff handling the animal are informed, option C, and proper cleaning protocols are followed after each visit, option D. The correct precaution is to isolate the animal, option B, to prevent exposure and minimize the spread of infection. Question 11. Which of the following describes the most accurate approach to interpreting a blood smear in a veterinary clinic? A. A blood smear should only be interpreted in the presence of a veterinarian. B. It is critical to focus on identifying and counting white blood cells to diagnose infections. C. Blood smears should be evaluated under the microscope to assess red blood cells, white blood cells, and platelets to diagnose potential diseases. D. Blood smears should not be used to diagnose diseases unless a full blood chemistry test has been performed. Answer. C. Explanation. A blood smear is an essential diagnostic tool in veterinary medicine. It allows the veterinary technician to examine the different components of blood, red blood cells, white blood cells, and platelets, under microscope to assess their condition and detect abnormalities. This can help diagnose various conditions such as infections, anemia, or clotting disorders. While white blood cells are particularly important when assessing infections, option B, thorough evaluation of all blood components is necessary to make an accurate diagnosis. Option is incorrect because veterinary technicians are trained to interpret blood smears under the supervision of veterinarian. Option D is also incorrect because blood smears can be diagnostic on their own, depending on the situation. Question 12. which of the following is the most important aspect of caring for a postoperative surgical patient in a veterinary clinic? A. Monitoring the animal's vital signs regularly to detect any signs of complications. B. Allowing the animal to eat and drink immediately after surgery to ensure they are recovering. C. Providing a warm environment without considering pain management. D. Withholding all medications to avoid further complications during recovery. Answer A. Explanation. The most important aspect of caring for a postoperative surgical patient is to closely monitor the animal's vital signs, including heart rate, respiration, and temperature. These signs can indicate complications such as infection, hypothermia, or cardiac issues. Why it is essential to provide pain management, which is not mentioned in option C. Offering food and water too soon. Option B can cause discomfort. Complications, especially if the animal is still under the effects of anesthesia. Option D is incorrect, as withholding medication, including pain relief, can result in unnecessary suffering for the patient. Question 13. Which of the following would be the most effective way to handle a fearful dog during a veterinary examination? A. Ignore the dog's anxiety and proceed with the examination to avoid drawing attention to it. B. Use a gentle and calm approach, allowing the dog to adjust to the environment at its own pace. C. Hold the dog firmly to restrict movement and reduce its anxiety. D. Immediately administer sedatives to calm the dog before any handling. Answer B. Explanation. A calm and gentle approach is the most effective way to handle a fearful dog. Allowing the dog to adjust to the environment at its own pace helps reduce stress and anxiety. Approaching the dog with a calm demeanor can also help build trust. Forcing the dog to remain still, option C, or sedating the dog immediately, option D, should only be used as a last resort after considering the situation carefully. Ignoring the anxiety, option A, can increase the animal's stress and potentially lead to aggression or injury. Question 14. Which of the following is the primary function of the lymphatic system in veterinary patients? A. To transport oxygenated blood throughout the body. B. To absorb and transport dietary fats and fat-soluble vitamins. C. To filter waste products from the blood and excrete them through urine. D. To produce and store red blood cells for circulation. Answer B. Explanation. The lymphatic system plays an essential role in absorbing and transporting dietary fats and fat-soluble vitamins from the intestines to the bloodstream. It also plays a critical role in immune function by filtering lymph and trapping pathogens. Option. It describes the circulatory system's function. Option C refers to the kidneys' function. And option D describes the role of bone marrow in producing red blood cells and making these answers incorrect in the context of the lymphatic system. Question 15. Which of the following is the most appropriate method for administering subcutaneous fluids to a dehydrated dog? A. Injecting the fluids into the intravenous catheter line. B. Injecting the fluids under the skin at several different sites for even distribution. C. Administering the fluids directly into the muscle tissue for faster absorption. D. Administering the fluids orally as it is less invasive. Answer B. Explanation. Subcutaneous fluid administration involves injecting fluids into the space under the skin, typically between the shoulder blades or along the back. Administering fluids at several different sites allows for even absorption and minimizes discomfort at any one injection site. Option. It describes intravenous fluid administration, which requires a catheter and is usually used when faster fluid uptake is required. Option C is incorrect, as fluids are not typically injected into muscle tissue, and option D is not ideal for dehydrated patients who need larger volumes of fluids quickly. Question 16. What is the primary function of an endotracheal tube, ET tube, during anesthesia in veterinary procedures? A. To prevent the animal from breathing too deeply and causing complications. B. To ensure the animal's airway remains open and secure for delivering oxygen and anesthetic gases. C. To monitor the animal's heart rate and respiration during surgery. D. To increase the rate of recovery from anesthesia after surgery. Answer B. Explanation. The primary function of an endotracheal tube is to secure the animal's airway, allowing for the controlled delivery of oxygen and anesthetic gases. It ensures that the airway remains open and reduces the risk of aspiration when food, liquid, or vomit enters the lungs. While monitoring heart rate and respiration, option C is crucial during surgery. The ET tube itself is not responsible for this. The tube also does not affect rate of recovery. Option D, as its purpose is focused on maintaining the airway during the procedure, not after. Question 17. Which of the following conditions is most commonly associated with the development of diabetes mellitus in dogs? A. Hypothyroidism. B. Hypothyroidism. C. Cushing's disease. D. Chronic kidney disease. Answer. C. Explanation. Cushing's disease, also known as hyperadrenocorticism, is most commonly associated with the development of diabetes mellitus in dogs. The excess cortisol produced in Cushing's disease can lead to insulin resistance, contributing to the onset of diabetes. While hypothyroidism and hypothyroidism can affect metabolism, they are not as strongly linked to diabetes as Cushing's disease. Chronic kidney disease, unrelated to the development of diabetes, although it may occur as concurrent condition in diabetic animals. Question 18. What is the most appropriate method for safely handling a fractious cat in a veterinary clinic? A. Administering a sedative to calm the cat before any handling. B. Using a towel or blanket to wrap the cat securely and reduce movement. C. Immediately placing the cat in a cage without any sedation. D. Allowing the cat to roam freely in the examination room to reduce stress. Answer. B. Explanation. Wrapping a fractious cat in a towel or blanket securely reduces movement and helps calm the animal by limiting its ability to escape or scratch. This method prevents injury to both the cat and the veterinary staff. Option A may be appropriate in some cases, but it is not the first line of action unless the cat is extremely aggressive. Option C could escalate the cat's stress, and option D would likely increase the animal's anxiety and lead to further complications. Question 19. Which of the following is the best method to prevent the spread of infectious diseases in a veterinary clinic? A. Disinfecting surfaces with a bleach solution between each patient visit. B. Using disposable gloves only when handling surgical instruments. C. Allowing all patients to interact freely in the waiting area to build immunity. D. Regularly washing hands and disinfecting equipment between patients. Answer. D. Explanation. Regular hand washing and disinfecting equipment between patient interactions are the most effective ways to prevent the spread of infectious diseases in a veterinary clinic. These practices help reduce the potential for cross-contamination. While disinfecting surfaces with bleach is important, option A, it is not the most comprehensive measure. Disposable gloves should be worn during any patient interaction, not just when instruments. Option B. Option C would compromise the health of all animals in the clinic. Question 20. Which of the following would be the most appropriate treatment for a dog with suspected pyometra? A. Administration of oral antibiotics to treat the infection. B. Immediate spaying ovariohysterectomy to remove the infected uterus. C. Intravenous fluids to address dehydration caused by vomiting. D. Observation and supportive care with the hope of natural recovery. Answer. B. Explanation. Pyometra is a life-threatening condition involving infection of the uterus, and immediate spaying ovariohysterectomy is the most effective treatment. The surgery removes the infected uterus and eliminates the source of infection, while intravenous fluids may be required to treat dehydration. Option C. They are not sufficient to resolve pyometra. Antibiotics alone, option A, are not an adequate treatment as they do not address the source of the infection. Observation, option D, without intervention can lead to septicemia and death. Question 21. Which of the following is an important consideration when caring for a geriatric cat? A. Ensuring the cat has a high-protein diet to maintain muscle mass. B. Keeping the cat in a warm environment to avoid hypothermia. C. Limiting physical activity to reduce the risk of arthritis flare-ups. D. Providing only soft food to prevent dental issues. Answer A. Explanation. A high-protein diet is essential for maintaining muscle mass in geriatric cats, as they are more prone to muscle wasting, sarcopenia as they age. While keeping the cat warm, option B, is important, it is not as critical as providing adequate nutrition to maintain muscle function. Limiting physical activity, option C, may not be necessary unless arthritis or other health issues are present. Providing only soft food, D, is not necessary for all older cats, as some may still have healthy teeth and benefit from dry food to help with dental health. Question 22. A 5-year-old Labrador Retriever presents with vomiting, lethargy, and a history of recent consumption of table scraps. Blood work reveals elevated liver enzymes. Which of the following is the most likely diagnosis? A. Hepatitis. B. Pancreatitis. C. Canine distemper. D. Gastritis. Answer. B. Explanation. The symptoms of vomiting, lethargy, and elevated liver enzymes, along with A history of recent tabled scraps are most consistent with pancreatitis. Pancreatitis is common in dogs that ingest high-fat foods, which can cause inflammation of the pancreas. Hepatitis option A also causes elevated liver enzymes, but it typically presents with jaundice and other signs of liver dysfunction. Canine distemper option usually presents with respiratory and neurological symptoms. A gastritis option D can cause vomiting, but it would not typically lead to elevated liver enzymes or other systemic signs. Question 23. Which of the following is the best method for preventing the spread of a contagious respiratory disease in a veterinary hospital setting? A. Isolating affected animals in a designated ward and using strict barrier nursing protocols. B. Administering broad-spectrum antibiotics to all incoming animals as a precautionary measure. C. Allowing the animals to interact in the common waiting area to help them build immunity. D. Keeping affected animals with other healthy animals to monitor for potential spread. Answer A. Explanation. Isolating affected animals in a designated ward and using strict barrier nursing protocols is the most effective method for preventing the spread of contagious respiratory diseases. This includes wearing gloves, masks, and gowns, as well as using separate equipment for each patient. Broad-spectrum antibiotics option B are not a preventative measure for viral respiratory diseases, and they can lead to antibiotic resistance. Allowing animals to interact option C could lead to further transmission of the disease. Keeping affected animals with healthy animals option D would also increase the risk of cross-contamination. Question 24 scenario. Mr. Rodriguez brings his 10-year-old Persian cat to the clinic for a routine checkup. The cat has been losing weight, drinking excessive water, and urinating more frequently. During the examination, the cat has a palpable abdominal mass. What should be the next step in the diagnostic process? A. Immediate euthanasia due to the cat's symptoms. B. Prescribe antibiotics to treat a possible urinary tract infection. C. Perform blood work and an ultrasound to evaluate the cause of the symptoms. D. Recommend a change in diet to address potential kidney disease. Answer C. Explanation. The symptoms of weight loss, excessive water consumption, and increased urination combined with a palpable abdominal mass are suggestive of a serious underlying condition such as kidney disease, diabetes, or cancer. The next step should be performing blood work and an ultrasound to evaluate the cause of the symptoms. Blood work can help assess kidney and liver function, while ultrasound can identify tumors or other structural abnormalities in the abdomen. Euthanasia option A should not be considered without a definitive diagnosis. Antibiotics option B would not address the underlying cause of the symptoms, and dietary changes option D would not be sufficient without further diagnostic testing. Question 25. Which of the following is a common clinical sign of feline lower urinary tract disease flood? A. Severe abdominal pain and vomiting. B. Straining to urinate or blood in the urine. C. Excessive drooling and difficulty swallowing. D. Sudden onset of seizures and loss of consciousness. Answer B. Explanation. Straining to urinate or blood in the urine are hallmark clinical signs of feline lower urinary tract disease flood. Flood is a common condition in cats that can be caused by a variety of factors, including bladder stones, infections, or idiopathic cystitis. Severe abdominal pain and vomiting, option A, may occur in other gastrointestinal issues, but are not typical of flood. Excessive drooling and difficulty swallow, option C, are more commonly associated with dental or oral conditions. Seizures and loss of consciousness, option D, are unrelated to flood and would suggest a neurological issue. Question 26. A veterinarian has recommended euthanasia for a terminally ill dog due to poor prognosis and intractable pain. The owner is emotionally distressed and hesitant about the decision. Which of the following is the most appropriate action for the veterinary technician to take? A. Encourage the owner to proceed with euthanasia immediately to end the dog's suffering. B. Offer to discuss the situation with the veterinarian and provide additional emotional support. C. Suggest alternative treatments to avoid euthanasia even if they are unlikely to improve the dog's condition. D. Leave the owner alone to make the decision without offering further support. Answer B. Explanation. Offering to discuss the situation with the veterinarian and providing additional emotional support is the most appropriate action. The veterinary technician should assist in facilitating communication between the owner and the veterinarian, offering empathy and clear information about the dog's condition. This approach allows the owner to make an informed decision while addressing their emotional concerns. Encouraging immediate euthanasia option without considering the owner's feelings is inappropriate. Suggesting ineffective treatments option C could delay the inevitable and cause more suffering for the dog. Leaving the owner alone option D would not provide the support needed during such difficult time. Question 27. Which of the following is a common side effect of corticosteroid therapy in dogs? A. Increased appetite and weight gain. B. Decreased thirst and urination. C. Muscle weakness and lethargy. D. Increased shedding and hair loss. Answer A. Explanation. A common side effect of corticosteroid therapy in dogs is increased appetite and weight gain. Corticosteroids can lead to increased thirst, urination, and changes in metabolism, which contribute to these effects. Decreased thirst and urination, option B, would be more likely in conditions like dehydration or kidney disease. Muscle weakness and lethargy, option C, may occur with prolonged corticosteroid use, not as common. Increased shedding and hair loss, option D, are not typical of corticosteroid therapy, although prolonged use could lead to coat thinning in some cases. Question 20. When performing a blood draw for a complete blood count in a dog, which of the following is the most appropriate site to collect blood? A. The jugular vein. B. The femoral artery. C. The cephalic vein. D. The saphenous vein. Answer A. Explanation. The jugular vein is the most appropriate site for a blood draw for a because it allows for a larger blood volume to be collected easily and with minimal discomfort to the animal. The femoral artery, option B, is not used for blood draws. It is used for arterial blood gas collection. The cephalic vein, option C, and saphenous vein, option D, are also used for blood draws, but are smaller veins, and the jugular is typically preferred when a larger sample is required. Question 29. What is the most important step when preparing a cat for anesthesia? A. Pre-anesthetic blood work to assess organ function. B. Giving the cat a sedative immediately before the procedure. C. Applying a heating pad to prevent hypothermia during anesthesia. D. Withholding food and water for 12 hours prior to anesthesia. Answer A. Explanation. Pre-anesthetic blood work is the most important step in preparing a cat for anesthesia, as it helps assess the cat's organ function and detect any underlying health issues that could impact anesthesia. Giving a sedative, option B, is not the first step, as it typically follows after blood work and assessment. Applying a heating pad, option C, is important during anesthesia, but it is not the first step in preparation. With food and water for 12 hours, option D, is generally recommended, but pre-anesthetic blood work should be done first to ensure the cat is fit for anesthesia. Question 30 scenario. A 3-year-old golden retriever is presented to the clinic with a history of coughing, lethargy, and difficulty breathing. The dog has been recently exposed to other dogs in a boarding facility. What is the most likely diagnosis? A. Canine distemper. B. Kennel cough bordetella bronchoseptica. C. Heartworm disease. D. Canine influenza. Answer B. Explanation. Kennel cough bordetella bronchoseptica is the most likely diagnosis, as it commonly causes coughing, lethargy, and difficulty breathing, especially in dogs recently exposed to others in boarding facilities or kennels. Canine distemper, option A, usually presents with a more severe systemic illness, including neurological signs, which are not described in this case. Heartworm disease, option C, can cause coughing and difficulties, but it would also present with other signs of heart failure or lung disease. Canine influenza, option D, can cause respiratory symptoms, but kennel cough is more common and more likely given the recent exposure in the boarding facility.